Zack was involved in a motor vehicle accident in which he had a traumatic brain injury and a traumatic injury to his arm. When he came to Dodd Hall, he had a external fixator on his arm, and he could not use one of his arms. He also had had a traumatic brain injury, which created trouble for him in memory, attention, concentration, and he also had visual problems because of it.
When I got to Ohio State, I didn't know exactly what was going on. I was just coming out of a coma, and my parents, my family, were the ones that had the main concerns, and they were obviously very worried about my future.
So all three disciplines, OT, PT, and speech, we all did our initial evaluations with Zack to see where his deficits were. We also talked with Zack and his family members to see what his goals were that he wanted to attain from inpatient rehab. Then from there, we developed our treatment plans. We all are extensively trained in our different disciplines. We go above and beyond the basic criteria which we need to meet in order to be speech, physical and occupational therapist, as well as recreational therapist. And we really care about our patients. We dedicate ourselves to our patients and what their goals are in addition to what our goals are. We really focus on patient-centered care.
That's one thing that I think that's unique about our therapists, is that they'll tailor things to our patients, to what they do for a living, to what they have an enjoyment in doing, to make sure that they're meeting the patient's goals.
We have to be really creative. As therapists, we know what we need to do and we have our goals, but in order to incorporate patients' goals, we have to think outside of the box often and try to make it as centered around the patient as possible. Motivation and buy-in are the two biggest things that we need from our patients to be successful, and if we can make the therapy activities applicable to them or make them so that they come up with the ideas themselves, they're going to buy into it a lot more, and they're going to have a much more investment in their rehab and their recovery. The nice part with Ohio State is that we have acute care, inpatient rehab here at Dodd, and then we've also got Martha Morehouse, which does the outpatient therapy. So we all share an electronic medical records. So the data that we collect while inpatient, goals met, activities that he's completed, we have that data in the EMR, or the electronic medical record, and Martha Morehouse gets our information from us, and then they can kind of pick up where we left off, so they're not starting from scratch.
The people at Ohio State were amazing. I mean, if you look at my therapists, all the therapists and all the doctors and nurses that I came in contact with were very helpful, and they treated me like family. They were an extension to my family.